Welcome to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck, and I'm a Rare New England Committee member and your host for today's show. Today, our show features Dr. Mark Korson, who is a founding board member of Rare New England. He is a pediatrician and metabolic geneticist. He works as director of the Physician Support Service and director of education at VMP Genetics. He is also co-founder and co-director of the North American Metabolic Academy. Dr. Korson has a wealth of experience and knowledge, and we're thrilled to have him here today. This show will focus on the concept of patients being active teachers for medical health professionals and trainees. Welcome to our show, Dr. Korson.
Thank you.
It's a pleasure to have you here.
Pleasure.
So first, I would like to start, what is a metabolic geneticist?
Well, a geneticist is a physician who takes care of patients, children or adults who have inherited disorders. Sometimes genetic disorders are associated with symptoms that one can see, say a patient with Down syndrome. But sometimes the problem is really a chemical problem, where there's some accumulating chemical and some deficient chemical, and either the too much of something or the too little of something causes symptoms. And that's what a biochemical geneticist looks after. And by reducing the amount of the accumulation or increasing the amount of the deficiency, whatever's being deficient, you can correct the imbalance and prevent long-term complications. So, complicated explanation, but that's a biochemical or metabolic geneticist.
Okay, great. So I know you personally are a pediatrician, a geneticist, and a teacher. That seems like a lot of roles to play. Can you talk to me a little bit about that?
Well, sure. Well, the truth is, rarely does one enter the field of genetics right from the get-go. So after one's medical school training, generally geneticists go into pediatrics first or internal medicine, which is a good thing because they learn a lot about what ordinary, more common disorders are. And then you focus in on genetics. And in that kind of situation, you start from a general primary perspective, and then you move into something very specific. But all of us are teachers. So that's just part and parcel of what it is to be a doctor.
Right. So it is not unusual that you are a teacher as a doctor. Most doctors are. Another person who is a teacher is the patient. We know that patients have their stories, and what role do they have in educating medical professionals?
Well, you know, it's interesting. Before the 1970s, most teaching of medical students occurred at the bedside. So it was the patients who actually taught, or the physicians who taught by asking the patient in front of the students or their residents. You know, they would ask questions. And then when technology advanced and slide presentations became the norm and PowerPoints, teaching moved away from the bedside and into the classroom or the conference hall.
I never thought about that.
And it's sort of weird. And of course now they have simulations where you actually have dummies in front of you where you can get hands-on experience, maybe in very complicated things where you don't have it as much with a patient, but you can practice. And that's all well and good, but it's shifted the focus away from the actual patient doing the teaching, and so that role is not as common now, and that's unfortunate because, you know, patients are more than just a collection of symptoms. They teach you how to communicate. They teach us what we should say and how we should say it and how we shouldn't say it, and they teach us compassion, and they teach us about the whole nature of the disease. Not just the symptoms. So, you know, unfortunately that's missing. And, you know, I as a teacher talk about cases, and that's interesting, but patients tell stories. And storytelling is extremely powerful. It's why we go to movies, it's why we read books, because stories last and they stay with us. Let's watch this story.
Okay, wonderful. We're gonna watch an amazing video about Zoe.
What's your hobby? My hobby is walking, singing, dancing, and my favorite present is, let's see, the boombox, and it holds 5 CDs. 5. Zoe? Yeah? What you want to
It's so really hard for me to describe Zoe in just a few words. To me, she was just extraordinary, and I mean, I know I'm a little bit biased, obviously, but I think that anybody that met Zoe, I kind of thought the same thing. She was just unforgettable. Zoe was a 19-year-old, almost 20-year-old. She was a student at the University of Arizona in Tucson. She wanted to be a nurse. She died suddenly last December of an undiagnosed rare genetic disorder called OTC deficiency.
In individuals who have mild forms of urea cycle disorders like Zoe, the patient may go unrecognized for years before a diagnosis is made, and it's really not until a perfect storm of triggers comes together to produce a catastrophic elevation in blood ammonia levels. Certainly, the blood ammonia level, when it's elevated, if it's not recognized, patients may progress very quickly to coma and death.
Patients can present with being lethargic or with GI symptoms like vomiting. They can also present with seizures or personality changes, and ultimately may lead to even coma.
In her teens, she started to have these episodes of nausea and vomiting. They were completely random. She would just feel sick and be sick, and then it would pass, and we could never really quite figure out the cause of it. We talked to the doctor, and but they weren't, you know, we thought maybe she had food allergies, but nothing ever really seemed to, you know, nobody said it seemed like it was serious, and it was so, like I said, it was so sporadic, we couldn't really pinpoint anything. Looking back now, it's easy to see that she avoided protein. Right after she went back to Tucson for her sophomore year, it was in September 2015, we got a call one night that a few of her friends had taken her to the emergency room. She had been really tired, and the nausea and vomiting were continuing, and the most worrying symptom was, though, that she was very, very confused. She couldn't, she kept repeating herself, and she was disoriented, and she her text messages, she would repeat them and they would be garbled. At the hospital, they ran a variety of tests. They gave her blood tests and CAT scans and MRIs, and of course they screened her for alcohol and drugs, and it came back completely negative. They kept her for a few hours, and they decided she was dehydrated, and they gave her IV fluids, and they released her with they gave her an anti-nausea medication, and they sent her home. Zoe never really felt completely well again. The next couple of months she continued to struggle with the nausea and vomiting, always really tired and lack of energy. My bubbly, enthusiastic girl was short-tempered and irritable a lot of the time, and she just wasn't herself.
There are certain triggers that increase the risk for high blood ammonia levels in patients with urea cycle disorders. These triggers may include things like a viral illness, an infection, going too long between meals, surgery, or pregnancy or delivery, or even things like dehydration or excessive exercise. In addition, other well-known triggers include a protein-rich diet or even a protein-rich meal and gastric bypass surgery.
A lot of times ammonia levels are drawn routinely in the ER setting because oftentimes doctors don't think about the diagnosis of a urea cycle disorder. These are, in theory, rare conditions, but because they're so easily detected and there are so many good treatments, it's critical to be thinking about these conditions because the consequences can literally be life-threatening.
2 days before she was scheduled to fly home for Christmas break, she was found unconscious in her apartment. They rushed her back to the same hospital, and they immediately suspected alcohol poisoning. But they did they checked her alcohol and drug level, and there was absolutely nothing in her system. They gave her every kind of test you can imagine. She had so many doctors, neurologists and pulmonologists and infectious disease specialists and seizure experts, and nobody could figure out what was wrong with her. During the whole time, she was never given a blood ammonia test, and it's a simple test that would have measured the amount of ammonia that was in her blood, and it would have probably pointed us in the direction of finding out what was wrong with her at that time. But she never had that test. On December 24th, we said goodbye to Zoe, and Christmas was always Zoe's favorite holiday. So. In trying to find out more about urea cycle disorders, we came across the wonderful people at the National Urea Cycle Disorder Foundation. We've been doing whatever we can to support their efforts to find a cure to save other lives like Zoe's. My primary goal is to help the foundation continue to provide education to healthcare workers on UCDs, especially emergency room doctors and nurses. I think it's really important that they be able to distinguish the symptoms of alcohol or drug intoxication from blood ammonia poisoning.
The National Urea Cycle Disorders Foundation has been one of the most important organizations in really moving urea cycle disorders advocacy and research forward. They, as an organization, have brought together researchers from many institutions to perform research and to learn about the right approach to treating and diagnosing urea cycle disorders. They have in fact aligned and worked with investigators and drug companies to develop life-saving treatments for urea cycle disorders. And even after the drug is approved, the NUCDF has been instrumental in advocating for families and patients with regards to access to these medications. They really have been the driving force in the field.
She was resilient and tough, and she would, if life handed her some kind of problems, she would bounce back fairly quickly. She was a fierce and loyal friend. If you had earned her trust, she had your back. That was it. She made me feel important and appreciated. I was just always really proud to say that I was Zoe's mom.
Hello, everybody. I'm the star of this movie, so don't forget to remember me.
How could we ever forget you?
Wow, Zoe is an amazing girl who made a difference in the world during her life. And fortunately, it seems that her story stays with us, but it is tragic. And, it's hard when you look at that to think what good could come out of this.
Well, all right, before we actually look at what good can come out of it. So after Zoe died, her parents donated her organs, including her liver. The liver is the organ that houses the urea cycle in its entirety. And that urea cycle is what was dysfunctional in Zoe. The man who received her liver died a week later in a high ammonia coma. And so that diseased liver, Zoe's OTC deficiency, did not just kill her, it killed somebody else. And this is not the first incidence of something like this happening. This has happened in other individuals who have had to go on to have second liver transplants. And in one case that I'm aware of, someone else is living with somebody else's, is living with the donor's urea cycle disorder. So they ended up switching their own cirrhosis for somebody else's urea cycle disorder. So the tragedy just continues here, unfortunately.
Right. So I know in talking about that, I believe you mentioned that Zoe's family talked about donation, organ donation. So that is something that, do you want to touch on that for a brief moment?
Well, yes. So for some, so in Zoe's case, in her particular urea cycle disorder, her other organs were actually functioning just fine. So she was a good candidate to be a donor for other organs. It's just in this case, the liver, although the liver itself was not diseased, it was just missing an enzyme. So in this case, that was not a good option. And I think what this particular case is teaching us, at least the transplant surgeons, is we need to do a better screen of who is donating their organs, and if the cause of death is not clear, especially in this kind of a case where there were symptoms going on for a while, maybe it's best to consider some of these metabolic disorders.
Right. And Zoe's story, I mean, you just watch this little girl grow into a beautiful young woman and face this tragedy. But I think her words at the end, you know, make sure you remember me. And I think that's what we're doing talking about this. But how does Zoe impact medical professionals? How does her story teach others? And that's what we want to kind of touch upon, because I think that's where the crux of this show is kind of talking about how can patients, I am a patient, and I know when I tell my story, it impacts people. But how does it impact medical professionals, and how can we, you know, continue to do that?
Well, okay, so welcome to the world of biochemical or metabolic genetics. This is a field of medicine where it is not taught well in medical schools or in postgraduate training programs. So in other areas of medicine, if there's not enough of one expert, often the slack can be picked up by other physicians. In this case, if you never really learned it, it's hard to play in that role and diagnose and treat. So unfortunately, that's the problem. So what Zoe's video does in a very dramatic way is teach about, one group of metabolic diseases that is in fact treatable, and long-term morbidity and mortality are preventable. So the lesson here is learn about these disorders. There's a funny saying in medicine that when one hears hoofbeats, think of horses. Well, from where geneticists come from, those hoofbeats are not the sound of horses, they're the sound of zebras. And of course, everyone laughs about that, right. But in fact, it's very true. Mm-hmm. But when all the tests that are looking for horses, come back negative, you know what? There are other things that can produce those hoofbeats, and that's why I'm in the zebra business.
Right. It's interesting. You're going to love the ending of our show, because we hear that every day. And it's interesting you talk about that for geneticists, but also rare disease.
Yeah, of course.
And that's, I think, why we're here with Rare New England, because all of these symptoms are not always apparent.
Yes.
And talking about lessons for medical professionals. So I know one lesson I just learned is that people should test for the ammonia levels. It's a simple blood test. Mm-hmm. But what beyond that? What else would you say Zoe's story is teaching the medical professionals?
Well, Zoe's video is very powerful for its content value. But what it teaches medical professionals, remember, medical professionals are teachers. What it teaches is the drama of that story and how effective that story is. So when I presented this story to a conference of emergency physicians, I asked them beforehand, how many of you would do an ammonia level as part of your practice, your current practice, how many of you will measure an ammonia level in a patient who comes in with disturbed mental status? And 0 responded that they would. After the presentation, including Zoe's video, over 95% said they would now do that. Now, I can't get that kind of results, but Zoe can.
Right.
And so what I've learned from this is I won't tell about a story if I can have a patient do that.
Right.
Because they do it in a human, very personal, very compelling way that I can't match. And why argue with success? Why compete with that? Involve them in the process, and it can be televised or shown, or it can be live.
Right.
They're both valuable. So what I would encourage my colleagues is get the patient involved any way you can.
Right. And I think you're right. I think so many times there's facts and figures, but ultimately what people remember are the stories.
Exactly right.
And what would you say to patients who, have gone through something and want to be a storyteller, or are thinking about, I know as a patient, for me, when I got done, it was like, well, how can I help others?
Yes.
And one way to do that is to raise awareness, to educate, but telling stories, that's not for everybody. But what advice would you give to a patient who is looking to do something like that?
Well, channel that energy and get your story out there. So when I've asked my patients, what are the top 2 or 3 things that you could change about your situation or your child's situation? Always among those top 2 or 3 are, I want physicians to know about this, so I'm not always teaching them, that they are aware of this disorder before I get here. That would unburden some of them. Well, unfortunately with disease, especially rare disease, the patient knows more about these disorders than the vast majority in some cases, of physicians they meet. So how to get the message out there? Be patient with the doctors, and if you can, even though the symptoms, especially if they're acute, are your driving priority at the time, be patient and remember that your role in teaching is extremely vital. And if you can accept that and figure out ways to teach effectively, you will help your own situation, but also the destiny of other patients as well. What else you can do is go to the Patient Foundation and tell them that you're interested in doing this, because the foundations are often approached with opportunities for teaching, and so they are often looking. So make yourself available, make yourself known. The other thing to do is go to your local medical school, and because they are often looking for patients or families who will speak to their students. And if you're on their list of patients willing to speak, they will call on you. Rare Disease Day is February 28th of each year. And so more and more medical schools now are using that as an opportunity to bring in patients, especially to talk about rare disease.
Right. I think another word that comes to mind, because it's, you as a medical professional are saying patients are their teachers, yet I as a patient think the doctors are a teacher. So it really leads to collaboration.
Exactly.
And we didn't really talk about this before the show, but I think that is such an important part. And I think when you talk about care, it's teamwork and it's collaboration.
Exactly.
But it seems like that translates into educating others, whether
That's right.
it be the public or each other or medical professionals or patients. So I think that's really powerful. That actually brings me to Rare Disease Day you mentioned. Rare New England has an initiative based around that. Would you talk a little bit about that?
So Rare New England is an interesting organization. It's not a disease foundation per se. It's a patient advocacy organization, but it's taken on, it has a sort of a unique niche of also focusing some on the providers, on the health professionals themselves, because if you improve their situation, either education or otherwise, the patient is going to benefit. So what we did starting in 2008 is we developed a speaker series where we bring in patients to tell their stories in medical centers, genetic counseling programs, or other medical venues, because these are stories that should be told, and these are audiences that have never heard these stories or don't even know about these diseases. So what a great opportunity to honor Rare Disease Day by doing so. So last year we had 6 venues, and this past year, in January through March of 2019, we had 9. Again, speaking at pediatric grand rounds and pediatric ward rounds and genetic rounds and in genetic counseling programs in all 6 New England states. So it's a win-win situation. It's a win for the patient because they really like doing this kind of stuff. And it's a win for the audience because they hear these stories. And I should say that actually if, another reason actually for patients to get involved in telling their story is it teaches you more about your own disease. It helps you think through your illness so that you are better informed. You end up learning how to prioritize what's important in your disease and what is important for others to know. And so I've seen speakers who over time have really updated what they talk about and how they approach it based on the feedback that they've gotten from telling their stories.
Right. And at these events, it's a combo, isn't it? It's a patient and a doctor kind of speaking to it. So you have the patient perspective telling their story, and then the doctor speaking on their side of what it means. And so I think that really speaks to the audience too.
Yes, and it really is, as you said before, the collaboration, which is really important. We often, our typical presentation is a brief overview of the clinical condition first. It only lasts about 10 minutes to give the audience a medical foundation for what they're about to hear from the patient, because sometimes the patient will use acronyms or they use terms or that are unfamiliar to the audience. And if I can introduce that first and explain that, then what the patient delivers is more readily accepted.
Right.
Yeah.
Excellent. Is there anywhere else that patient teaching is occurring that you're aware of, or?
Yeah, I mean, often it's not uncommon actually. Some individual physicians are doing this in their medical schools or at their medical centers because there are, they have patients with striking case histories that they want to, and they use them as teaching opportunities. But I'm not aware of anywhere that's doing this on a sort of an organized way.
Right.
And so wearing my other hat as Director of Education at VMP Genetics, we're actually in the process of developing a national patient-teacher registry where we are approaching patient foundations, asking them if they can refer to us patients or family members who are interested in telling their stories for this very purpose. And we've identified and right now we're focusing on metabolic genetic disorders, and we've identified about 85 foundations. And ultimately, what the registry will not be a public listing of names, because that's personal information, and that's not it's not our goal to do that. What we will have is a list of diagnoses and where they can be found, so that if you're in Chicago, Illinois, there are 2 patients with urea cycle disorders, 1 with methylmalonic acidemia, 3 with mitochondrial disease, 1 with Fabry disease. And so, as an example, and if an educator in that area sees that list and wants to have one of them come in, that educator will call us. We will vet them to make sure that they are who they are. In other words, a faculty member at some medical center or medical school. And then we will pass on that contact information to the patient or family, and it's up to them if they want to make contact or not. So in that way, we protect their confidentiality and give them the opportunity.
Right. So you give the power to the patient,
exactly,
yet you make the connection if that's what they want.
Yes.
That's very exciting to kind of have that option.
Hey, you know what I noticed? Can I say one thing?
Absolutely.
I really appreciate these. Talking about zebras.
Absolutely.
It
yes.
actually.
Yes.
Yes.
And wait to the ending. Oh, you're ready for it. It's coming.
Yes.
Do you have any final words to say before we close?
No, except that, as you mentioned, the patient-doctor collaboration is exceedingly important. Yes, I have the information, but you have the drama. And long after the audience forgets what I say, they will remember your story. So, you know, if you have a story to tell, you know, there are doctors who are looking to work with you.
Right.
So, thank you.
Well, thank you. RNE in Motion. Before closing, we provide our viewers with an opportunity to share comments or ask questions from our prior shows. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. Please send us your comments or questions to info@rarenewengland.org. We will share your responses on our next show. From our last show, we received a question from a patient who was wondering where to find help and resources since her child was just diagnosed with a rare disease. We encourage you to look at the Rare New England website and check out the resources page. This has both educational and practical options for you to consider for your child. We wish you the very best. Thank you for your inquiry. That's our show for today. Thank you again to Dr. Corson for being here. From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, and then zebras. Thank you.